My name's Ed Howard, and I want to welcome you on behalf of Senator Blunt, Senator Cardin, our board of directors, to this program today on how best to empower consumers as they make more and harder healthcare coverage and care decisions. I suspect that you've heard the point, even in these briefings, made repeatedly, that consumers are being asked to do a lot more, to take a lot more active role in selecting their insurance plans and their providers and evaluating their care options. Well, today we're going to look at how well consumers are prepared to make those decisions. How literate are they, for example, when it comes to things like deductibles and copays? What information do they have available, and how hard is it to get that information? And can these empowered consumers, if we can empower them, drive the system toward lower costs and higher quality? Those are the other two of the triple aim. Now, we're pleased to have two partners in today's program. Anthem, which among other parts of its business operates Blue Cross plans providing coverage to more than 38 million Americans, and the National Consumers League, which is America's oldest consumer organization. Their mission is to protect and promote social and economic justice for consumers and workers. Now, I should mention that with these same partners, Anthem and the League, we'll be exploring in September a related topic, that is the kinds of tools available to us when we become actual consumers of care, otherwise known as patients, and we think it will be a valuable bookend to the kind of discussion that we hope to have today. A couple of logistical checkoffs here before we get going with the substance. You'll see that the Wi-Fi credentials are on the screen. They're on the table in front of you in case you want to get onto the internet. And one of the things you might do if you need that is to tweet comments and questions about the conversation. The hashtag consumer health is the key to doing that. Now, in your packets, you're going to find a lot of information, including speaker biographies, more extensive than I'm going to have time to give our folks. There's a one-page materials list that you'll find useful, I believe, along with the PowerPoint presentations that the speakers are going to use. You can find all that, by the way, also at our website, allhealth.org. There's going to be a video recording of this briefing available as early as Monday, followed by a transcript a couple of days later, also on allhealth.org. At the appropriate time, I have two colors for you to remember. Green question cards, where you can use your pencil or pen to put a question on them and have them brought forward, and we'll try to get to as many of them as we can. And the blue evaluation form, which we hope you will take the time to fill out before you leave, because we want to get your feedback, particularly those of you on congressional staffs, because we want to be responsive to the kinds of information, the kinds of speakers, the kinds of topics that you think are important in trying to get to your job. So let's get to our job, which is to present you with this program. We have a terrific lineup of panelists today, and we're going to go through those presentations and then open it up for questions both among the panelists and from the moderator, and you will have a chance to ask your questions as well. And we're going to start with Rebecca Burkholder, who's the Vice President for Health Policy at the National Consumers League. Rebecca, we've asked to give us a sense of some of the challenges that are posed for consumers today in selecting a health plan, in other aspects of the engagement process, and what consumers think is important in making those healthcare decisions. Rebecca, thanks very much for for being with us and for lending the expertise and experience of the league in trying to put this program together.
And thanks, Ed, for that introduction. The National Consumers League is really pleased to be here today and to be working in partnership with Anthem and the Alliance as we bring you this series of briefings focused on the consumer. So today, as Ed was saying, we are going to be talking about empowering and engaging the consumer, especially as they make choices about their health care coverage. So the healthcare system today can often seem overwhelming and confusing for consumers. And when it comes to selecting coverage, as this slide shows, consumers need to be doing a lot. They need to make sense of drug formularies, sort through copays and deductibles, calculate out-of-pocket costs, decipher a summary of benefits, and ensure they have the convenience of their providers being in network. And this isn't even get to deciding on their treatments and care. So we'll be talking about these issues today, as well as in the next briefing in this series in September, which, as Ed said, will really focus more specifically on those tools for consumers as they actually choose their healthcare treatments. So first, let's look a little bit at the context in which consumers are making these choices. So where are consumers getting their coverage in today's health insurance market? As you can see in this chart from Commonwealth, in 2014, over half received insurance from their employer, 19% from Medicaid, 4% individual or off the marketplace, 3% Medicare, 2% military, 2% from the marketplace or exchanges, and in 2014, 12% uninsured. So what are the choices that consumers have actually in the health insurance marketplace under the Affordable Care Act? So you can see from these slides, the number of issuers, or those companies or entities providing insurance, has grown. There are 25% more issuers participating in the marketplace in 2015 compared to 2014. And in 2015, consumers can now choose from an average of over 40 health plans, and that's up from 30 in 2014. So this really offers new opportunities for consumers to comparison shop and select the plan that best meets their needs. I want to talk a little bit about the environment for decision-making in healthcare for consumers. And in recent years, there's been some trends that have really impacted this environment for consumers. So first, this huge growth in use and availability of healthcare information, and much of this is by the internet. So our access to 24-hour-a-day, constantly evolving information and misinformation about our healthcare options is both overwhelming and can sometimes both present opportunities to improve our health care, but can also in some cases be hazardous as well. According to a recent Pew survey, 35% of US adults say they have used the internet to try to figure out what medical condition they or another person may have, what we call online diagnosis. 2, there's a desire by consumers to be more in control of their health care. Patient engagement in healthcare has been termed the new blockbuster drug of the century. In fact, we know that patients more engaged in their healthcare have better health outcomes, and some studies show lower costs as well. So this consumer involvement and more active healthcare decision-making just goes to the case of how important it is to make sure they have the tools and information they need. Third, a shift of cost to consumers, to individuals, in their healthcare costs, and therefore more consumer responsibility for informed choice regarding their health benefits. And this is certainly true for high deductible plans or consumer-driven health plans that allow consumers to design their own benefits more. So they're not just choosing a plan, but levels of deductible, premium, and choice within networks. So really being careful about how they spend those healthcare dollars. Fourth, this increase in advertising noise. The average consumer in the United States is exposed to, as you all know, thousands of ads each day. Ads about over-the-counter drugs, ads about prescription medications. And the consequence of too much advertising is really this clutter, and it becomes harder to attract consumer attention, to hold their attention, and consumers, all of us, also put up these defense mechanisms in that we just tune people out. We tune information out. And fifth, another trend is this declining level of trust in institutions, including insurance companies and healthcare organizations. which really explains the skepticism consumers may have when they get messages or information from certain entities. So it emphasizes the importance of establishing really reliable and unbiased sources of information. So all these trends point to the growing need for reliable information for consumers as they face more choices. And we know from studies that faced with too many choices, people tend to set their expectations really high, and they put a lot of responsibility on themselves to make sure they're making the right choice. So generally, what are consumers seeking when they're choosing a health plan? First of all, value, of course. They want the most coverage for premium they can afford. They want to make sure that the plan covers the care that their family needs, including their medications, taking into consideration their financial circumstances. They want quality information. They want information on the health plan and consumer enrollee satisfaction, including what consumers report about experiences with the doctors and the healthcare providers in the network and the customer service. Consumers are also interested in quality information, specifically reported at the physician level. For example, for someone with diabetes, did the doctor perform regular blood sugar tests or cholesterol screening? And then, of course, cost information. Consumers want to know what their own out-of-pocket expenses for a service, given their insurance benefits, including deductible, copayment, other cost sharing, will actually be. Consumers want cost estimates for a complete surgical procedure, such as a joint replacement, and don't want to be surprised by added-on costs later for an anesthesiologist. So I want to take a little bit of look at the challenges that consumers face when picking health coverage. Especially, I want to focus on two: literacy and transparency. So this slide has some information from the 2006 National Center for Education Statistics study. So engaging patients in their own healthcare and healthcare decision really relies on health literacy, and that's patients' ability to obtain, process, communicate, and understand basic health information and services. So only 12%, about 1 out of 10 US adults had proficient health literacy according to this survey. So that means they're able to use a table that would calculate their cost for insurance during a calendar year. So over a third of US adults, 77 million people, as you can see from the pie chart, are in the below basic or basic group and would have trouble figuring out some common healthcare tasks such as a prescription drug label or an immunization schedule. Also, according to this survey, adults over 65 had lower health literacy. Limited health literacy affects adults of all racial and ethnic groups. Compared to privately insured adults, both publicly insured and uninsured adults had lower health literacy skills. And adults living below the poverty line also have lower health literacy. So poor health literacy can be even more problematic for those entering the insurance market for the first time or have not had insurance for a while. And that's the case for many people enrolling in the Affordable Care Act. According to a survey, 37% of enrollees did not know the amount of their deductible, and for many people, their deductible will be really important to their budget, and in some cases more important than the premium they will pay. If people don't understand their deductible and pick a plan based solely on the premium, they're going to be in for a big surprise when they start spending, getting healthcare services, and their deductible hits. Many enrollees also don't grasp the understanding of some basic health insurance terms. A study of people eligible to enroll showed that many, 60%, were not confident in some of these basic terms, as you can see listed on the slide. And this lack of confidence can really have an impact. If people don't understand what it means to pick a provider out of network, and they do pick a provider out of network, they can face some higher out-of-pocket fees. And then lastly, people with lower incomes were less likely to understand key elements of insurance. So really, people who need coverage the most may understand it the least. So, and then secondly, another challenge is healthcare transparency, which I know Joel will be talking about a little bit more too. So, we want to make sure that consumers have information up front about the health plans they choose. I know when I pick a major health appliance like a dishwasher, I'm going to be able to easily access information, star ratings, consumer reviews. Let's make sure consumers have that for healthcare coverage as well. We know that consumers now, in most cases, have the ability to browse anonymously on the marketplace plans, but we want to make sure that's the case for all plans. Drug formularies, we want to make sure there's clear information for consumers on which drugs are covered, especially those consumers with chronic conditions. We also want to make sure that consumers have reliable information on the providers that are in their health plans, and that there's a direct link to that directory, and that directory is up to date. And lastly, consumers need access to prices on common medical procedures as well. So what does it come down to for consumers? In some cases, we can boil it down to three questions. What does the plan cover? Is the plan going to meet my health needs and the health needs of my family? How much does it cost? I need to consider the monthly premium, but also the out-of-pocket costs. And is my doctor in my plan? Is the hospital down the street in my plan? Consumers want that for convenience. So I think with that, I'm going to turn it over to my other panelists. Hopefully I've set the context for some of these issues that consumers are facing. Thank you.
Terrific. Thanks very much, Rebecca. I should say, by the way, if you're watching on C-SPAN, and for those of you in the room, I will say they are not watching live on C-SPAN, but it will be on the, excuse me, on the broadcast schedule later and on the website. If you are watching on C-SPAN, you can find all of these slide presentations, all of the background materials on the Alliance website at allhealth.org. So try to make use of that if you would like to. Now we're going to turn to Natalie Schneider. She's the Vice President for Consumer Experience at Anthem, and we've asked her to describe ways that Anthem and other insurance companies are trying to respond to the consumer needs that Rebecca was trying to sketch for us. Natalie, thanks so much for coming.
Thank you. Thanks, Ed. So as Rebecca alluded to, consumers are moving pretty swiftly into the center of this healthcare ecosystem, and they're the ones driving the changes we're seeing today. And it's not an incremental change either. This is an industry-defining pivot that's taking place. And it's quite frankly causing health plan executives across the nation to issue this collective OMG, because rumor has it, health insurance has not been particularly user-friendly in the past. But there is a sense across Anthem, and I'd say certainly across the sector, that things are different, that we're doing business differently. And we're not taking the position that we're large enough to sway the market. We're really, really listening, and we're paying attention to what our consumers want. And in order to understand sort of what's driving this level of urgency and determination that I'd say is rather unprecedented, we really need to take a look at sort of the narrative and how that is unfolding right across the health ecosystem. And the first thing is, increasingly more consumers are picking and comparing plans that didn't exist before, to the tune of 87 million customers by 2018. That'll be the size of the retail market. And that's the lion's share of growth for many national plans. Secondly, as Rebecca mentioned, we're moving more towards narrow networks and these high deductible health plans, which means in the past where the phone book was really the provider network, now you actively need to engage to figure out, is your doctor network, and actively need to compare prices. And thirdly, and I don't want to exhaust this theme, we all know affordability continues to remain a persistent challenge. $22,000 for the average family of four. That's the price of in-state college tuition or a new vehicle. So they've got more skin in the game. And then we're seeing this tsunami of healthcare innovations from Samsung, Under Armour, Apple, all these different companies targeted right at the consumer. And in many instances, this is empowering the consumer to take more control of their health by providing them better insights into their own pathologies. And lastly, the sort of unforgiving, skyrocketing expectations that consumers like you and I have when we engage with Uber, Amazon, all these companies that have 24/7 service through channel of your choice, and really, really great personalization. So we know all of this is occurring. We also know that insurance companies today sort of don't meet a lot of these expectations. If you look at our starting point, for those of you that are optimists, we're unfortunately not third best in terms of our NPS scores. It's actually third last. We're barely above cable companies. And so we know what our starting point is. We also know this is unsustainable, in a consumer choice market. So as I mentioned before, we're really beginning to make changes. And if you think about how health plans are responding and how they've looked at this problem historically it's been sort of this find and fix approach. And we've realized we've come across this inflection point whereby we need to go much faster and we need to go much farther and we need to break away from this traditional mode of doing business. And we also know the way in which you create distinctive, seamless, really easy consumer experiences, the type you see in hospitality or retail, is through the deliberate application of hundreds of decisions that are carefully orchestrated through the application of sort of these 6 disciplines, which are best in class: strategy, consumer understanding, consumer design, measurement, governance, culture. And if you look at consumer understanding as an example, we did something quite novel. We went out, we listened to consumers, and we really listened to 10,000 Americans through focus groups and interviews to try find out what makes them smile, what really ticks them off when it comes to health insurance. And that allowed us to sort of coalesce around what are the things that matter the most. And we're measuring this through net promoter scores, through customer satisfaction, and through member effort. And we're holding ourselves and our executives accountable. And we also discovered that what consumers want the most, and you'll see some sort of symmetry in the remarks between Rebecca and I, is confidence, clarity, and ease. They want confidence that they'll be covered when something bad happens. That is, after all, why you buy insurance. They want clarity in that they need to know what they bought and what it'll cost them. And today, quite frankly, that is not the case. And they want ease, and the nuance here is by ease, they mean minimal interaction with their health plan. In fact, they don't want a relationship with their health plan. It should work somewhat like a utility. Think about your water and lights. It should work seamlessly in the background without much, mind share or sort of administrative overhead, except when an issue arises. And then they need high levels of engagement, high levels of personalization, and they need competent responses. And while these can't be reduced to broad generalizations, the interesting thing was, through all of this research, is they're actually more similar across segments, across Medicare, Medicaid, group and individual, than they are different. And this is a very satisfying answer because it means you're sort of solving for the same things. And we also found that when we interrogated the data, not everything matters. In fact, you get to diminishing returns pretty quickly, and that there were 7 critical moments that matter the most to our customers. It is when you're selecting a plan. We find that by and large, consumers want the decision about a health plan to be over and done with. It's equated to filing your taxes, getting the middle seat on an airplane, getting a tooth extraction. They just want it over and done with. And, between these critical decision points, they want to be separated from the gravity and responsibility of making their choice. But today, there are complex variables. It takes too long. It's really frustrating, and it's a high anxiety event. So as it should be, making plan selection highly intuitive and easy is one of our biggest priorities going into the next few years. Once they've selected a plan, like other purchases, they want to feel valued, they want to feel secure, and they want to know what they've bought. And today it's frustrating. You're sort of inundated with all of this paperwork that's really complex, really frustrating, and let's be honest, how many of us have opened up a letter from our health plan recently and responded with, wow, that was incredibly helpful and very, very easy. I'm glad I read that. For the most part, it's really, really complex. And as Rebecca said, even the terminology that's being used. So we're taking as an example the 40 most confusing terms that are used in healthcare and insurance, and we're recoding our digital and our print assets just to make it simple for people to understand. They don't know what a provider is, by the way. So that's sort of streamlining sort of the onboarding process. And then in terms of what's it going to cost me, we also know that costs are frequently unpredictable and unmanageable. And when consumers are asked about the most frustrating part of treatment, they say it's dealing with cost, which is why 70% of them are demanding hospital prices to be posted online. So as it should be, transparency, cost and quality transparency, which Joel will expand on, is going to become one of the most critical consumer capabilities to empower them, especially as we move to those narrow networks and high deductible health plans. When they're faced with a medical decision, typically they've got a chronic condition and they need help staying well. They want to deal with someone that has empathy. But the nuance here is they don't want a health plan to intersect that relationship with their provider. So this is an area where we're treading carefully, and we're trying to figure out how do we diminish the hassle factor for both providers and for consumers in a way that we're not trying to own that relationship, but we're trying to facilitate that mechanism and keep them well. And when they need urgent care or if they're unplanned needs, this always happens at 3 o'clock in the morning, if you notice that. This is that moment when anxiety skyrockets because they're typically not using their regular PCP. And we're using our innovation lab, in fact, in Atlanta, and I know this is an area that a lot of people are focused on, to figure out how do we help them quickly understand what's covered and what isn't. What is the most appropriate side of care? It can't always default to ER. And they need help navigating to a specific side of care. And we're also focusing very heavily on quality, as Rebecca mentioned, to make sure that our provider directories, et cetera, are correct, so we're not having incidences of people going to providers that are out of network. When you pick up your prescription, this isn't necessarily a high anxiety event, but when you think about Medicare and duals, this is a really high frequency event. So we're trying to figure out, for something that happens so frequently, how do we streamline and make it as simple and hassle-free as possible? And lastly, the moment my insurance company says no, for any of you in the room that have experienced sort of a claim denial, it's a highly abrasive event. So we're working more upstream, and we're trying to figure out what interactions can we have with the consumer to prevent that from happening? Or if it does need to occur, how can we be as empathetic as possible? So we believe as health plans become more systematic and more professional about the approach to consumer experience, they're going to be able to break away from this competitive convergence that exists today. And at them in particular, we think the only way, given the complexities of modern healthcare, to treat our 36 million Medicare, Medicaid, individual and group customers is to deliver exceptionally well against the basics, against what you see on the screen today, in a very anticipatory manner with ultimate simplicity and elegance. Thanks, Ed.
Great. Thanks very much, Natalie. Let me grab the clicker here. And if I can, let me just take you back to the 5 reasons slide, if you would. There's 6. And there's 5. The very first one, the 87 million people you describe as being likely to be in consumer choice segments. Is that basically high deductible plans and consumer directed plans that constitute that population?
That is primarily made up of private public exchanges, but also Medicaid. And what we're talking about here is, in the past, as you know, employers really made those decisions on behalf of a lot of consumers. So it's all instances in which the consumers are actively reviewing and selecting their plan choices. And you think about how the membership calculus changes in that situation. When an employer is making a plan, if 60% of the employees are satisfied, 100% will renew because the employer is making the decision. In the case of a retail market, if sort of 2/3 are satisfied, 2/3 will renew with the health plan, and the rest will buy from somebody else, which is why this has really got the attention of health plans.
Gotcha. Thanks very much for clarification. Next, we're going to turn to Joanne Volk, who's a senior research fellow at Georgetown's Center on Health Insurance Reforms. We've asked Joanne to relate some of the policy issues that are raised by the challenges that both Natalie and Rebecca have been talking about that face consumers as they choose an insurance plan and try to use that coverage. Joanne, good to have you back.
Nice to be here. Thank you. I'm going to talk about those policy options that have come out of the Affordable Care Act. First, a tool that's available to everyone with private insurance, and secondly, some tools that are available in the marketplace for plans chosen from that. I'm going to start with a quiz, though. By a show of hands, how many people in this room have seen a form like this? That's encouraging. This is the Federal Employee Health Benefit Plan summary of benefits and coverage for one of the options for federal employees. And I'm going to be talking a bit about this form. This is the first page of a 8-page standard form. The summary of benefits and coverage, which I'll hereafter call SBC because that's a mouthful, applies to all commercial or, private insurance plans. So whether you're buying as an individual in the marketplace or outside on your own, or buying through your employer, you will have a summary of benefits and coverage available to you. The goal of creating this under the Affordable Care Act was so that consumers would have a way to make apples-to-apples comparisons of their health plan options when they were shopping. Certainly, we have a history of health plans providing summaries of their benefits, and some were quite good, but they varied depending on the carrier and what they chose to cover and how they might convey the information. So if you simply wanted to do an apples-to-apples comparison of your plan choices, which may be greater in the marketplace than through an employer, you would have to decipher a number of different forms until the SBC came along. And now you have sort of top-line information. You can look across the plans and see what your deductible is, your maximum out-of-pocket, and other rules that are important to you when choosing a plan. It must be provided upon application for coverage once you enroll. When the benefits or costs change enough that it would prompt a change in the content of the SBC, and then upon request. I will say one shortcoming of this requirement for when to provide it is that third one, when the benefits change enough to change the content of the SBC, because there are a lot of different ways your plans may change over the course of the year when you're locked in during the plan year that wouldn't necessarily change the content of the SBC, and you wouldn't necessarily get a heads up from your plan that something's changed. The first page, as you might have remembered seeing that example, is a bunch of top-line information that's probably most useful when you're choosing a plan, what the deductible is, how it applies, what the maximum out-of-pocket limit is, whether or not you need a referral to see a specialist, which might be important for some folks to know that, for example, they can get to their dermatologist or podiatrist without having to make a stopover at their primary care doc. And then beginning on page 2 are a bunch of things called common medical events that will tell you what your cost sharing will be for various things you might pursue over the course of the year. So a hospitalization, a doc visit, lab tests. It'll tell you about your provider network, what your costs would be depending on the tier, what your costs would be for your drugs depending on the formulary tier. There are also coverage examples at the back, which there are 2 now. One is for having a baby, and the other is for a person with diabetes. These are only intended to be illustrative, because any individual's costs will actually vary depending on the specific services they use. But again, it's supposed to be sort of a high-level way to compare plans and say, if you're a person with diabetes, to know roughly what your costs might be under one plan versus another. The summary of benefits and coverage must also include a statement on minimum value and minimum essential coverage. These are 2 important ACA-created terms or concepts. The minimum value is something that is the minimum value that all plans have to meet, and will tell you whether or not your employer plan meets one of the tests for getting premium tax credits on the exchange. The other is minimum essential coverage, which is the term that is applied to coverage that you must have to meet the individual mandate. And then finally, I want to share with folks that there are changes currently being discussed for the template that would take effect in 2017. The feds previewed a proposed set of changes to the template. The NAIC, the National Association of Insurance Commissioners, is currently debating what some of those changes might be to make recommendations to the feds, and I'll talk a little bit more about some of the changes that they're considering there. I will say, for example, that we've learned in some of our technical assistance work at Georgetown with navigators in some states, helping consumers enroll in marketplace coverage, that the deductible was a really tough idea to get their arms around. What services they might get prior to the deductible, how the deductible was applied. Has anyone ever heard of an aggregate versus a embedded or non-aggregate deductible? Yeah, you have? Okay. So it matters. It tells you how you accrue your expenses towards your deductible if you're in a family or an individual policy. And that may be important for some families. For example, if you have one high-cost individual, you want to know that they're going to get to their individual deductible before everyone spends enough to hit the family cap. They're also looking at changes to better define preventive services. This is one area, I will pause for a moment on preventive services. This is a hugely popular benefit. This is the idea that for recommended preventive services, you should be able to get them free of charge. We learned in our discussions at the NAIC, I'm a consumer rep there, and I've been participating in the discussions, helping consumers know exactly what preventive services they may get cost-free is a nearly impossible task. There is a list on healthcare.gov, but whether or not it's recommended for you will matter. Whether or not you get charged an office visit copay in conjunction with that preventive services, whether or not your plan has to cover that list yet. They have a year to adopt new recommendations, for example, we found was very difficult. So this just highlights some of the challenges with the summary of benefits and coverage trying to capture accurate and complete information. I'm going to move now to the marketplace and some of the tools that are available there. First, I want to talk about consumer assistance. Every exchange must operate a navigator program that is responsible for doing education and outreach and enrollment and eligibility. In state-based marketplaces or state or federal partnership marketplaces, there were additional resources to provide additional consumer assistance in the form of in-person assisters. So we certainly saw more consumer assistance funding and options in non-FFM states because they had some funding opportunities there to do that. And in fact, they outspent the FFMs. This is a critical piece because there's some consumers that are just not going to be able to get there on their own. We did a report off of our experience providing technical assistance, and for the families that qualify for financial help, they can be incredibly complex lives, and they're trying to fit within incredibly complex rules about availability of other coverage, whether it's Medicaid or employer coverage. They may have shared households that have a grandchild living in the household. They may have fluctuating wages because they have three jobs that pay hourly wages, and they cut back their hours during certain times of the year. So we found that for some consumers, they absolutely need to have this in-person assistance to help them understand what they're eligible for and choose a plan. Certainly the literacy challenges that Rebecca talked about came up frequently for exchange shoppers. But so the navigators had to work with that. They also often had to deal with post-enrollment questions. So once they helped them enroll, they'd come back and say, now how do I use these benefits? Going forward, there are funding constraints. There's a little bit more money for the FFMs this year, but the idea is that they're going to try to leverage other resources, including brokers and some of the online tools I'll talk about next to help more consumers get there without the in-person assistance.
And Joanne, just to clarify, FFM applies to,
The federally facilitated marketplaces.
as opposed to the state
State-based, and then
exchanges.
also those that run their own, sort of the partnership states that run some of the functions themselves. Quickly on some of the policy tools that are going to be available in the marketplace, there are a number of things coming online that will make it easier for consumers. One is a new rule that all those SBCs that apply to people who get cost-sharing reductions must reflect what their cost-sharing would be. So for those that don't know, if you're in a marketplace plan and you have income under 250% of poverty, you would qualify for an enhanced plan that fills in some of your cost-sharing to better than platinum for some, almost platinum for others, and a little bit better than silver for some. In the past, it was not a requirement that your SBC actually had to show you what your costs would be with that additional help. You sort of had to imagine it, which made it complicated. They're going to roll out for this next open enrollment an out-of-pocket cost calculator for consumers. Similar, if you look at the materials in your packet about the discussion about the FEHBP tools that help you sort of estimate your costs going forward, not just the premium, the deductible, but what they might look like with your office visits as well. There are going to be improvements to the provider directory and the formulary. For one, the provider directory now has to be updated monthly. In the past, we saw experiences where consumers did their due diligence to see if their provider of choice was covered by a plan, only to find out that the directory was out of date or inaccurate. They're going to have to also include information that's important for consumers, like whether or not the doctor is taking new patients, their medical group that they might be part of, an institutional affiliation, as well as contact information. The drug formulary must also be easily accessible from the website, be updated with each change to the formulary. So in fact, if there's a change in the formulary that one drug is no longer covered, it shouldn't take effect until consumers can see it in the updated formulary online. And in both cases, this information must be available in machine-readable format, which is intended to help outside vendors convert it into other consumer tools they can use to search for a plan based on a particular provider, for example. And finally, I want to touch on one function of the marketplaces, which is in certifying marketplace plans to be qualified health plans or carriers to participate in the marketplace. There is one function, the certification includes the requirement that the exchange act in the interests of consumers, which is sort of this catch-all that can mean that they can do things beyond the minimums required by the federal law to make it easier for consumers. Georgetown did a report with Sarah Dash and others that looked at some of the tools that state-based marketplaces, requirements they placed on plans to further standardize their benefits so that you could look at a set of plans and know that they met certain requirements for cost sharing. I think you heard a lot about that from the California Exchange with Peter Lee earlier, but it's this notion of a consumer, for example, might know that they'd get 3 doctor visits before meeting the deductible in a set of plans and further refine the plan so that it's easier to compare. And that's it.
Okay, great. Thanks very much, Joanne. And by the way, we've heard a lot about literacy and the challenges to it, and I want to call your attention to one of the pieces in your materials. I think it's way in the back on the left-hand side. It's a Department of Labor-produced glossary, which is about as simply put and clearly written as anything I've seen on this subject.
That is a companion piece to the Summary of Benefits and Coverage. It's required to be made available, and in fact, within the SBC, there are a bunch of terms that will be underlined or in bold, which means you can find them in the glossary to know what they mean.
Terrific, thank you. Finally, we're going to hear from Joel White, who, among other things, is the president of the Council for Affordable Health Coverage and its Clear Choices campaign. Some of you remember Joel, I'm sure, from his 2 decades of service on the Hill, including 6 years on the staff of the House Ways and Means Committee. And Joel today is going to talk to us about cost and quality transparency, including the ways to help consumers, employers make more informed healthcare choices. Joel, thanks for joining us.
Thanks, Ed, and thanks for making me feel a little old today. Didn't think it'd been that long. But thank you to the Alliance for putting on this briefing. We think it's absolutely critical at this point in healthcare that we have this dialogue around healthcare transparency and the information that's being presented to consumers as they make choices about not only their health plans, but about their healthcare providers and their prescription drugs. And so I'm going to talk a little bit about what's going on in the marketplace right now and get into so a few policy options, actually, to talk about presenting that better information. So just real quick, Clear Choices is a multi-stakeholder advocacy organization, and that's why I'm talking about some of the policy options, and these are some of our members. But why do we need transparency? Why do we need better information in healthcare right now? I think that unless you've been living under a rock, healthcare costs are increasing. Sorry for the news flash. But we're estimated to spend about $40 trillion over the next decade alone. And the total cost that a family is spending on that healthcare is increasing, and it's increasing at an alarming rate, we think. 18% of total family income was spent on healthcare in 2002. Today, that's about 35%. By 2030, it's going to be 60% of a typical family's income. What we're seeing on the ground right now in terms of the marketplaces is next year we're looking at an average premium across 45 states of about 12%. That's on top of a 5.4% increase in 2015. So the costs are starting to stack on the premium side. Why is that important? Well, we know that people in 2014 and 2015 made a lot of their plan choice decisions based on the price, and the price they were looking at was the premium. They weren't generally looking at the cost sharing, and the important thing with what we're seeing on the Affordable Care Act exchanges is that the cost sharing is significant. In fact, it's much more than what we see in the employer market. And so what we're seeing is higher plan cost sharing and deductibles. This year, the typical silver plan, which is where most consumers are signing up for an individual, had a deductible of about $2,900. For a family, it was about $5,800. That compares to about $1,400 on a typical employer plan. There is significant variation in both cost and quality of coverage for providers that are included on those plans. And so the confusion that I think a lot of consumers make is as they shop for a lower price plan, they're not necessarily looking at is the provider included in the directory, is the network a high quality, high value network. And the other mistake that we see in the research that consumers make is that they equate more expensive coverage with higher quality on the provider side. And so absent good quality information on providers, people can actually be choosing higher cost, lower quality providers. And because these costs are increasingly being shifted onto consumers, they are running this risk of choosing this lower value health coverage. So just very quickly, some of the things that we're seeing in the marketplace, we know that consumers have more information on televisions than they do on their doctors. If you've ever been to a retail setting where you're looking at the price of a TV and you've whipped out your smartphone and gone on to Amazon to check the price, that is a real consumer experience with televisions. Just try this little test. The next time you're in your doctor's office, ask him for his email. You're more likely to get information on your television than you are to get your doctor's email, is the point. Prices within local markets vary significantly, and we see this from New York all the way down to San Diego and Sacramento to Washington, D.C. It is about a 700% difference in some local markets. What we see on the healthcare.gov website is that a lot of times the consumer experience is that it's not user-friendly. It's very difficult to compare and select health plans off healthcare.gov. And as was mentioned, there aren't some basic rudimentary tools available on the state-based exchanges and the federal exchanges for determining whether a provider is on that network in that plan, or whether a particular drug is on a formulary at what tier, and even to compare the common name versus the scientific name. Finally, I think that what we see in the marketplace is a lot of the data just isn't available to people. And so this is leading to a lack of tools that are increasing healthcare costs. And in fact, Donald Berwick, who used to run CMS, has said that this increases costs anywhere between $84 billion to $174 billion every year. And while $90 billion is a pretty big range, that's still a lot of money even here in Washington, D.C. So in terms of the goals, I think what we have been able to divine through our stakeholder groups is that there are three core issues that I think we need to satisfy to make an effective system for consumer choices. The first is we need better data. Basically, we need to measure the right things, and we need to understand what consumers value in order to empower them in making choices. And they can only make choices through better tools. And so these are improved health plan websites and improved things like out-of-pocket cost calculators. So better tools will lead to better data, and better tools will lead to better markets. And if we see better operating markets, we think that people will have additional choices that will help address some of the cost issues that we're seeing. And so if I can kind of drill down into some of those issues there, the first on the better and more data is that what we're seeing through HHS is really a lot of data dumping, and it's being dumped out there without a lot of context. And so people get confused just by the data that CMS is releasing. I'll give you, for example, earlier this year there was a release of physician claims data, the thought being that I could get online and search my provider and see how many claims he was responsible for, the cost of that provider. The media picked up on this, and a lot of it was gotcha journalism. So my provider is the most costly provider because they prescribe the most costly drugs, for example. That's not necessarily helpful to a consumer. I could turn that around and say, my provider does the most hip replacements and therefore is an expert at doing hip replacements. So we need to put this data into context, which means that HHS really needs a strategic framework for the information that it's releasing. The second thing that we know consumers really value is this cost-quality equation. In other words, the value equation. And right now, we don't have very good measures of quality. So the information that could be presented on some of these health plan comparison websites just simply isn't available. We're measuring the wrong things and things that consumers don't necessarily find helpful. For example, most of the measures used in federal programs right now are measures of underuse. Did I perform the mammography on the preventive screen? Did I do some of those other preventive measures? It doesn't measure overuse or misuse. Did I prescribe an antibiotic, for example, for a viral infection? Some of those types of quality measures are absolutely critical to consumers because they get at the core competency of the provider. And then finally, we know big data is kind of a catchism, but the more data that we have in the system, the better, more granular insights we can make. And right now, Congress passed an SGR law earlier this year. But right now, we know that HHS is going to find it very difficult to double the amount of claims data in the system because Medicaid and CHIP data is not standardized at the state level. We need to standardize that data and put it to use at the federal level so that consumers can use that information to make better choices. Switching over to better tools, one of the things that we think is absolutely critical, and we took a look across the CMS plan comparison websites, and we also looked at healthcare.gov, and we looked at a number of the state-based exchanges. And we're going to be releasing a paper on best practices for plan comparisons this fall, which will include a number of consumer focus groups and what consumers actually value in making plan selections. And I think what we found was a little disturbing. A lot of the websites don't present accurate information, and they don't present it in plain English. It's very hard to select a plan on a website where you're trying to make an honest comparison if the information itself simply isn't accurate. And if there are loaded terms, jargon-based terms that are being used, we've heard today that some people don't even understand a deductible. Well, we've got to get better at presenting this information in plain English. From our perspective, though, the initial research that we've done, there are three primary things that I think consumers value. The first is the searchable integrated provider directory and formulary. As has already been discussed, I think, by all of our panelists here, it's absolutely critical to know whether or not your provider is in network or not in network. It's absolutely critical to know if your drug is covered by the formulary, on what tier, and to know that information based on its plain English name, not its scientific name. Why is that important? Well, if your provider's not in the plan and you have to go out of network, that adds to your cost sharing. And not only that, it doesn't count against your annual limit. So it has a negative financial impact on the consumer. The second thing is there has to be a smart comparative display. I need to be able to match up my Anthem plan with my Aetna plan with my Blue Shield of California plan to make an apples-to-apples comparison across, say, deductibles, cost-sharing amounts, premiums, and covered benefits, as well as the providers and the formularies. What we're not seeing on some of the exchange websites, certainly, and on healthcare.gov, is those good, smart, comparative tools that empower the consumers. And then finally, something that came under a lot of criticism, but that consumers really value and makes a heck of a lot of sense, is we need to allow people to window shop. We need to allow them to compare those plans before they have to actually log in, get a username, or sign up for a plan and commit financially. Doing those three things, we think, would vastly improve the consumer experience in the marketplace, would also vastly improve and continue to bring down the number of uninsured. It would be a better match for plans, better match for consumers that we think ultimately will lower healthcare costs. And thank you, Ed, for having me.
Great. Thanks very much, Joel. Excuse me. We'll now get a chance to get into an interchange. We have microphones that you can use to go to and ask questions in your very own voice, or you can pull out that green card, write something on it, and hold it up, and somebody will bring it forward. And I want to get us started here actually with what Joel was talking about in the way of the steps that could be taken if the regulators and the people who run the marketplaces were to be able to do them or were required to do them. But I wonder whether the private sector is doing in its segment where it is controlling, whether it's in dealing with employers or in private exchanges, are they moving in this direction any faster than the government seems to be doing? Joel?
The simple answer is yes. What we're seeing is a lot of innovation at the plan level. I think what we saw in 14 and 15 was a lot of competition, like I said, on the price. I think a lot of the plans, and Natalie could probably speak to this better than I can, a lot of what they're seeing now is they need to have that service component, the customer service component, where they're attracting people and they're saying, look, we got to get a better fit here, because it's not just the consumer who's not harmed, but it's not just the consumer who, if they sign up for the wrong plan, their provider's not on in the network, or their drug's not on the formulary. That doesn't just impact the consumer, it affects the plan as well, because the plan then has to deal with an exceptions process, an appeals process, and really not having a good fit for that individual. And so having this information, I think, actually better matches up consumers to the right plan. And what we're seeing is some acceleration of the innovation around the plan tools that are available in the marketplace, but not yet on the exchanges.
Rebecca, you want to comment on that? Or Natalie, or both?
No, I would agree, and it's to everyone's benefit that the consumer is able to pick the plan that best fits their need. I mean, I think the challenge, and Natalie, you can talk about this some more, is how do you do that, and so that all consumers can really have that information and match it up accordingly. And, without really being able to predict the future, too. We've been talking here about how consumers choose their health coverage, but we need to always remember that's just one small step in their healthcare experience. As you said, they want to pick their health insurance and be done with it. But how do we make that experience the most productive that it can be?
Mm-hmm. We've found that by and large, consumers have absolutely no idea what they've purchased. And we have verbatims from the focus groups and interviews that in some instances people are using eeny, meeny, miny, moe because of the way we name products, and because there's a $2 difference in sort of the different products. And we know that affordability is still king. And a lot of people are buying on price, but without fully comprehending what the implications are with respect to co-pays, deductibles, and all those types of things. So that's remains the most significant challenge to overcome.
Ed, one of the things I want to, your question about what employers might have been doing, I know one of your members is Pacific Business Group on Health. They've had a tool for a while that allows consumers to sort of estimate their out-of-pocket costs. We use it at Georgetown. It, like the one, I think, for the federal employees and like the one being contemplated by the feds, still requires consumers to sort of place themselves as a low, medium, or high healthcare utilizer, and it's a very rough estimate, and it's difficult to, again, predict the future. So even if you have a planned event, like you want to get pregnant later in the year, if it turns out to be a complicated pregnancy, that's going to cost you more than you anticipated. Even if you're a person with a chronic condition like diabetes and you generally know how many doc visits you're going to need or what drugs you're going to take on a regular basis, you don't know what else is coming down the pike. So I don't want to oversell these tools. I mean, they're useful as a way to sort of ballpark things and help consumers shop and compare, but it's still a very rough estimate because healthcare by its nature is just sort of an unknown in the year ahead.
But for those planned events, and Joel spoke about this, just the huge variation in price with no discernible difference in quality. And we know, for example, that neck MRIs will range in price from $2,030 to about a tenth that amount. So, while there is a lot of unpredictability in the cost, there are certain instances where, we can really come very far along in terms of helping people estimate costs and sort of partake in the favorable economics of smart decision making.
just add one more thing?
Yes.
And that's just about this whole issue when we talk about the tools for consumers of choice architecture design. So it's really how we present this information to consumers. And there's been some studies that consumers will go with the default. So really have to think about how we're presenting the cost information if it's just based on premium. So careful thought needs to be put into that.
Very good, thank you. We have a lot of folks lined up. We would ask you to be as brief as you can in stating your question, and before you do that, identify yourself and your affiliation if you have one. Yes, sir, go ahead.
Hi, my name is Stephen Spitz. I have two related questions on costs. One, I had an experience in a hospital where they said that I needed a certain common procedure, and I asked what the price was. I gave them my insurance information, and they came back and they said, we don't know. I'd like to know how common that is and what is being done to try to let folks actually know what something costs. I might add, I had at the time a high deductible, so it was an important question about my out-of-pocket costs. The second question is Medicare Part D, when I noted in the biography that Mr. White was involved with in 2003, has a provision prohibiting the government from negotiating prices with the drug companies. And my question is, why is that still in the law?
You want me to take that one, Ed?
Why don't you start? And
I'll do the first one, and the second one real quick. The first one was, why can't they tell me what the price is? Like I said, you know, forget about the email. Ask them what a price is, and it's like getting trade secrets out of Cuba, right? It's next to impossible. What we're seeing is that what the price is and what I owe are two different questions, right? And so if I have coverage, I think a lot of the plans are really good at estimating your costs. But sometimes not always. For Medicare, the vast majority of people have third-party coverage, and so it varies what you owe. But there's a bill moving through the House, it's actually part of Cures, so I guess it's in the Senate now, that said for Medicare, you've got to provide consumers a max out-of-pocket across the hospital outpatient department setting and the ambulatory surgery center setting. And so we need to get, that's a kind of a blunt tool. What we need to get to, and what's going to be really exciting, is as more data comes into the system, we're going to be able to parse this and cut it and slice it so that I can tell you, if you're on Medicare, this is exactly what you're going to owe for this procedure at this facility. If you're insured in the commercial market, this is what you're going to owe. If you're uninsured, this is what you're going to owe. Because what we see is that the price you pay is going to depend on what kind of coverage you do or don't have. This is kind of the first question. The second question is the HHS is prohibited under Part D from negotiating drug prices. The private sector is not, and the private sector plans, PBMs and managed care health insurers, aggressively negotiate discounts in Part D. And I can't remember what the latest figure is, but it's somewhere around 20–25% discounts off prescription drugs for seniors. The interesting thing when we enacted that law, we talked to CBO about that specific provision. HHS getting in the middle of these negotiations, private sector negotiations to get drug discounts, versus letting the folks who do this on a daily basis negotiate the discount, the private sector. And they said if you had that provision in there, it'd probably mess with the negotiations, but you definitely wouldn't save any money. And if you repealed that provision in law today, what CBO will tell you is it will not save a single dime. The reason is those PBMs and those health plans are already negotiating the discounts, and they're already being passed on to consumers. So that's that's one of the reasons we did it.
Joel, going back to the first part of that question, someone sent forward a question on a card, a suggestion actually, after a long description of a situation to which it would apply. Is it possible for providers to get access to health plan cost calculators so that they are able to inform consumers about their expected out-of-pocket costs before the services are rendered? Is that a practical possibility, Natalie or Joel, or for that matter, anybody else on the panel?
You know, I wouldn't say it's commonplace today. It's definitely something that we're exploring, is in fact that whole in-office doctor's visit. And, you know, I remarked early on about how we don't want to intersect that relationship, but certainly how do we make more shared decision-making tools available at the point of service, so that when you're taking out your pad to write a script, or you're comparing different treatment options, that you have transparency into that today. So I wouldn't say it's commonplace. I'd certainly say that's where the market would like to move.
Well,
Yeah,
one
go ahead,
caveat, though, from the consumer perspective, some of this matters too on how the claim is submitted. So we saw this in the discussion around preventive services when I talked about the confusion there about what you may be able to access as a consumer without cost sharing. Part of it is how it's submitted by the provider, and part of it is how the claim is paid by the carrier. And depending on how all that flows may in part dictate whether or not you have a copay for that service that you might have expected none for. And I think this comes up regularly, that's another sort of unknown in the pathway from the care that you receive to the bill that you get.
Yes, go right ahead.
I'm Dr. Caroline Poplin. I'm a primary care physician. Just to answer the gentleman's question about price, price is proprietary information. Every insurance company negotiates a different price with every provider, or with every large provider, hospital. So the price is different depending on not just what your plan is, but who your insurance is. And the insurance companies don't want other insurance companies to know what kind of a deal they got from a big hospital. So that won't go away. My question is unrelated to that. I have two. A quick one for Rebecca. You said that surveys show that health insurance providers are less trusted, and I was wondering where that information is, where you got it from? The source?
Yes.
Way
I
back.
want to make sure this is on. I can share that with you. I think it was from numerous sources, but I'm happy to share that with you. I think it was on my slide that it's noted.
Yeah.
And, you know, that's been declining over decades. And still some of the most trusted providers are the healthcare professionals themselves. But we've seen this gradual decline with health plans.
And Natalie, one of your slides makes the same point, right? That insurers are pretty far down there, and maybe if you had that source, you could provide it as well.
Yeah.
Sure, I don't have there are plenty of publicly available sources, and I think it's sort of skepticism with institutions in general, but our sector, you know, has come under criticism with respect to trust issues, I think because there is so much opaqueness around sort of cost and how that whole sector works.
And you had another question,
Yes,
Caroline.
a real question. Something that hasn't been mentioned at all. You assume that people know what they want, or they'll recognize it when they see it, at least. And behavioral economics has shown that, in fact, with regard to health, people have really no idea about what they need, except for sick, chronically ill people who know what their conditions are, know what medications they're taking, know what they need, better than a healthy person. For example, it's said that women are much more afraid of breast cancer than they are of cardiovascular disease, but cardiovascular disease is a much bigger and more likely threat than breast cancer. So if they don't know what they need, how can they choose it?
I would say that's the question we're trying to answer. And so, again, everybody's going to have their different take on what they think they might need or what they're most worried about. So that's why information needs to be presented in various ways so that consumers can look at the different, whether it's preventive care, whether it's maternity care, whether it's joint replacement. But you're right, they don't know what they don't know.
That's right. And the sensible thing to do then would be to give a comprehensive plan for everybody, like apparently they do with the California exchange. That was, I think, what the gentleman said last week or the week before, that the plans on the exchange were standardized.
Well, it's standardized to the degree that you can know that with a certain set of them, you can get a bunch of services without having to meet your deductible first. So that's
Is that all?
particularly useful, I mean, you still have the actuarial value, you still have this metal levels that set a general level of generosity, and they come with big deductibles, as Joel was saying. So for, the silver level plan is at 70% AV is far lower than the typical employer plan, which is closer to like 85% or higher AV. So that means you have higher out-of-pocket costs. But I believe in California, they've said there's a certain set of services you get without having to meet your deductible. And for a relatively healthy person, that can be really important, who otherwise wouldn't necessarily see the value of their health insurance if they didn't know that they could get 3 primary care doc visits and a set of generic drugs without having to meet a $2,000 deductible, for
Okay,
example.
I thought it was a much more standardized than that, not just preventive services. But Ed, were you there? Do you remember?
Two different
I
questions.
think it was everything but like specialty drugs and like high ticket, high cost things. There were a bunch of things that you could, primary care visits, prescription drugs.
Okay,
The
thank you.
transcript from that briefing is on our website, by the way. I think we're here, actually. I think this gentleman was in line first, then 2 people over here, and then we'll go back this way.
Thank you very much, Bob Rowe with the BMJ. We have, consumers are really drowning in choices and options there. One thing the system tried to do was with preventive care is at least limit the package and define it a little better. We heard today that they may not have done that good a job here. I guess my question is primarily, is there any role for simplifying and standardizing what insurers can offer and how they can offer it?
Wow.
Well, the actuarial value is supposed to be a way to bucket plans in big terms, like the relative generosity by metal level. I touched on this. One of the requirements for all plans is that there has to be a meaningful difference in the marketplace, but that still leaves a lot of wiggle room. So the kinds of things that they're doing in California or other state-based marketplaces to limit the number of plans that or products that any given carrier can offer, or to standardize them so some set covers the same things in the same way, is one attempt to do that, and that's certainly within the authority of the marketplaces.
The reason I said wow was I would actually argue the other way. I think people like choices. I think when you think about someone with breast cancer versus someone who has cardiovascular disease versus someone who has cancer, they're going to value different things in different plans. And one of the reasons I think we see, I think the Affordable Care Act did a very good job of saying plans have to do X, Y, and Z. I think a byproduct of that X, Y, and Z has been limiting options for plans in order to offer lower prices. And that's why we're seeing some of the higher cost sharing in the plans. And so I think that to the extent that plans can do a better job explaining the nuances and the difference in their coverage, that will be very important. But I think limiting choices is probably the opposite direction, at least that I would say we should go, because healthcare is so personalized, it's becoming increasingly personalized. And as we develop those cures and therapies for cancer, cardiovascular disease, some of those other things that are really going to benefit from precision medicine, we should probably go the opposite way on the choice side, not further constrict it.
Go ahead,
I would also
Rebecca.
agree with that, even though I talked about how some consumers can be overwhelmed with choice. We do like our choices, and everybody's in a different situation, and also their threshold on risk really varies. So again, the solution is, or the answer is, how do you present those choices?
And you were talking about the framework for choice, and presumably there are standards for the optimal size of the choice universe for individual consumers. Is that fair?
Yeah, that's correct. And also it's how, again, I talked about how we present that information to consumers, and what you present first is really important, because consumers often, even though we want to allow all that customization, there's been studies done that consumers don't always go in then and customize it. So how you present it, that default position, is really important, whether it's just showing the premium, whether it's showing the deductible, whatever it's showing preventive services, et cetera.
Okay. Natalie?
not to pile on, but I think the answer is perhaps a little more nuanced in that, we talk about the paradox of choice, and when you're overwhelmed with too many things where you can't distinguish between them, it actually adds to your frustration. So it's about sort of curating that set of highly relevant options where it's very clear what the difference and the trade-offs are between them. So, I think it's having choices, but you've got to know what they are, and they've got to be relevant to you.
Yes, sir.
Hi, my name is Ken Sharma. I'm with Enroll Virginia, and we predominantly help people who are below 400% of federal poverty level, so usually people who have very low health insurance literacy. So my question to the group is, why not work at insurance companies reducing complexity and reducing the jargon instead of trying to educate these consumers on some of this jargon and trying to get the consumers to learn the program as opposed to changing the program?
Yeah.
We are, that's precisely what we're doing. We're actually going sort of artifact by artifact, letter by letter, screen by screen, and really looking at it through the lens of the consumer, which is quite new, I'll say, for our entire sector. We used to sell to employers primarily, now we're selling into end customers. And, one of the examples, as I mentioned early on, is taking sort of the 40 most commonly misunderstood terms, things that probably everyone in this room is very familiar with, and recoding those, but also kind of taking every single customer journey and literally storyboarding it out and making it easy and more simplified. And this, by the way, is stuff that banking, retail, hospitality has already done. And so we are a little behind as a sector, but that's very much the focus of the consumer centricity strategies that the large health plans have underway today.
Yeah, and I would just say we need to be really careful that we're empowering the consumer and not blaming the consumer. So you're absolutely right that the information needs to be presented in that understandable way, that plain English way, so that consumers can understand. And I would just add on to that, healthcare professionals really need to be part of this too, that there needs to be more education on how they can communicate clearly to patients, and also need to be thinking about if information is available in other languages as well, and when it's translated into those other languages, that's also understandable and accessible to people.
I think some of this reflects kind of the bumpiness of the shift in strategies. I think, one of the things the Affordable Care Act did was, for the industry, people are now looking at this direct-to-consumer type channel, and whereas before they were going, to the employers or to the brokers and agents, and that's a difference. And so there's some bumpiness in the marketplace and some turbulence. But I think, probably what you're hearing is that a lot of the carriers recognize this, they're working on it, and there's a lot of really smart marketing and other people in the system who are probably going to get us back to something that's more plain English, accurate, reliable, and that consumers can really understand and get their arms around.
Just one more thing. I'm going to bring it back to the SBC. To the extent that this is out there more and more, and consumers can really build experience with using this to choose plans and use their coverage, I think it becomes easier. It's an education process that they're going to learn the terms and how to use their benefits. The glossary that Ed talked about, we heard that there's a infographic on the last page that explains how deductible coinsurance and out-of-pocket limit works, and we heard from some consumer testing that was enormously helpful to consumers to make those concepts understandable in a way that they haven't been before.
Okay. Yes, go right ahead.
Hi, Linda Bennett, and I'm with AFSCME. And I just want to piggyback on a statement that Rebecca just made and Joel and others have said about plain English, but that the demographics now and in the future are that there are more limited English proficient or non-English proficient speakers as consumers and stakeholders. And so beyond translating for the plans or the SBC and having good navigators explain, when they get that card and they go to a provider, I'd like to ask Natalie, what is Anthem and the industry doing to make sure your in-network providers have access to the interpreter in-person services they need, so that they have good communication and you have an empowered consumer? And what are you doing to make sure that that's a system that there's a system of support? Are you monitoring the electronic records where they say, look, we know this person has limited English proficiency, they prefer their documents in something else? Are their providers providing them with an interpreter?
Just want to make sure I understand the question. So you're saying sort of at the site of care where we have sort of limitations or constraints in terms of English speaking, what are the support capabilities to ensure that the physician is engaging with the patient?
In the language the patient prefers, that they have an interpreter. Part of this is, with the state of Washington for its Medicaid program, they have a statewide interpreter program where every provider that's Medicaid covered can get on and say, next Wednesday, I need someone in Russian to speak Russian at 10. I need someone in Mandarin at 11. I need someone in Spanish at 3.
No, I can't speak to sort of what the health plan is doing specifically in that venue, in the side of care. I'm not sure if anyone else can speak to. No, I think that hospital systems and providers probably have a response to that. I'm not entirely sure, sort of, again, being careful about how does the health plan intersect that relationship. We want to ensure, which I think is where you're going, that we reduce the hassle factor, we make it simple and easy. I'm not sure I'm well enough educated on what Anthem specifically does in those venues.
Yes, ma'am.
Hello, my name is Ariel Zena with the Smarter Healthcare Coalition.
You need to get closer to the microphone.
Sorry about that. My name is Ariel Zena. I'm with the Smarter Healthcare Coalition. And earlier today, I think Rebecca raised that given the increased cost sharing, consumers are responsible for making more informed decisions, and providing information and providing clear information on cost and quality was raised as one of the solutions to facilitate those informed decisions. But I wanted to highlight that in April, a Kaiser Family Foundation study showed that only 6% of consumers actually looked at price information, and only 2 to 3% actually used that information. So I was wondering, kind of, in light of that, particularly given that consumers indicated they don't actually want a real relationship with their health plan, who is really responsible for providing that information and informing consumers? And then also, when that information is presented in a clear and understandable way, how do we ensure that consumers actually are using it rather than just assuming that they want that, and if it's available, they will be accessing it?
So, yeah, there's this issue about consumers saying they want quality and cost information, but also knowing that they're not always accessing it. But the thought behind that is that it's because it's still not presented in a way, usually, that's accessible to consumers and really answering the questions they have about cost and quality. So I think part of it, again, is just how we're presenting that information. As far as the high deductible plans, we do know that recently, I think there was a survey by Families USA that 25% of families that had the high deductible plans were actually foregoing health care. Were not taking their medications as often as they needed to. We're skipping follow-up care. We're skipping preventive care. And I think some of that research showed that sometimes consumers were picking those plans because they couldn't afford the higher premiums that gave them a lower deductible. But some people may have actually not looked at the information as carefully as they should have about that cost. I'm not sure if there's any way we can absolutely ensure consumers read and understand something, but we can do a lot better job of presenting the information.
And I'd say it's where you are on that adoption curve, and I'd say we're probably still on the linear part. We haven't gotten to that knee of the adoption curve. And when things become open table easy or Amazon easy, I think that's where you really see the kick up. So we know we've got traction. We know there's still data quality issues, et cetera. But there is certainly demand. It's just not sort of surfed up in a way that's incredibly convenient and incredibly digestible right now. But I think the intention is there, the strategies are there, the investments are being made, and the one thing that I think sort of reinforces this is the amount of third parties and external investments in these solutions, Vitals, Castlight, and other third party groups that are making massive investments in this area of capabilities.
One of the things that I think is absolutely critical is the information also has to be actionable. Like, it doesn't really do me a lot of good if you tell me the lowest cost provider in Des Moines. I don't live in Des Moines, right? And it's got to be in network, right? Or out of network, right? It's got to be an actionable type solution for the consumer in order for them to use it.
Okay, I'm not sure which of you was first. I will leave it to your sensibilities.
Thank you. Bob Griss with the Institute of Social Medicine and Community Health. When Ed introduced this topic, he said that the subject is, can an empowered consumer drive quality and costs in our healthcare system after the ACA? And I think we've heard lots of information about costs going up and people being overwhelmed with choice. What I learned so far is that empowering the consumer really means overwhelming them with choice, so you can blame them for the fact that they don't get what they need. But what I don't hear any discussion of is the strategy on Capitol Hill to defund the Agency for Healthcare Policy and Research, which is designed to study healthcare quality and to translate good practice into systems that providers can be held accountable for. In other words, while we're focusing here so much on consumer choice, the very function of government to improve the regulatory system or to even conduct research on what quality means is being taken away from us. The House Help Committee, probably represented by people around the chairs in the audience here, has voted that as early as the beginning of 2016 to zero out the budget for the Agency for Healthcare Policy and Research. How can we take seriously a conversation about healthcare quality and choice when we're undermining the very foundations of government's function in doing this?
Okay, there's a question. Anybody want to respond to it? By the way, it's the Agency for Healthcare Quality and Research, thanks to a former co-chair of the Alliance Board, Bill Frist.
I love ARC. I think they do great work. I think the answer to this problem is going to be found in the private sector. It's not going to be found through ARC.
Yeah, I think you're referring to ARC, the Agency for Healthcare Research and Quality. Yeah, and we do a lot of work with them, and they've done an excellent job on producing plain language summaries for consumers and comparing various treatments. So, I would hate to see, our organization would hate to see that funding go away. We think they're instrumental in producing information for consumers and being able to compare treatments.
We have just a couple of minutes left. This will be the last question, as Karnak used to say. And I would ask if you would multitask by starting to fill out the blue evaluation form while you're listening to this insightful question.
So my question goes into, when I think about empowering healthcare stakeholders, I think a lot about the expansion of HSAs and other medical savings accounts. And I was wondering, with your experience, have you seen people making the phone calls and finding out their drug is half the price at Walmart than it is at CVS? And have you found people are foregoing care or pursuing more efficient care based on those decisions?
And I have a related question on a card. Would you like to identify yourself, sir?
Sure, I'm James Calderwood with AdvaMed.
Okay. The card question says, 97% of insurance plans have price transparency tools, but only 2% of policyholders use the tools to shop for prices. What can insurers and Congress do to promote the use of price shopping? So, are we shoppers, or can we be made into shoppers in this healthcare field?
I think you need to be clear that for a set of services, you're not in a position to price shop, right? There are some things that are time sensitive. You're not going online to do your research. It's not like buying a refrigerator or a car that you can take your sweet time and do all the research you want. Even for those services where you might have time and incentive within the form of a high deductible to do shopping, we heard today that it's difficult to know the price. I would argue that price is just one factor that consumers might consider. The price of the service, the price that they pay out of pocket, but it's also convenience and a preference for providers and other factors that come into play. I'm going to share my one little personal example of a person who tried to use price to make a treatment decision, and it went very awry. For my daughter, I had to choose between 40% coinsurance on a $17,000 drug or a $70 shot, and my carrier could not tell me what my copay would be if I went ahead and got this procedure, what my cost would be out of pocket. It was based on how the provider was going to submit it and how it got paid. So even in the best of circumstances, when you make efforts to do a price comparison among your factors that you're taking into consideration, it can be hard.
I think we're getting there. I think we're getting better data. We're getting more powerful tools. A couple of private sector initiatives were put here. I have an HSA. I love HSAs. I worked on the law when it first was enacted. They do promote shopping, and I think at our heart we are all shoppers. We all make comparisons. We make judgments every day about a whole number of things. One of the areas I'd highlight is we went and took a look on a lot of the state-based exchanges and then healthcare.gov, and unless HSA was mentioned in the title of the plan, you couldn't tell whether that plan was HSA qualified or not. So right now, under the tax code, however you feel about HSAs, there is a significant tax benefit to signing up for an HSA and its associated high deductible health plan. But consumers aren't getting that information just by going to an exchange website. So one of the things that we think needs to change, and this could be done regulatorily or through legislative action, is we ought to tell consumers that this plan's HSA qualified, this plan is an HMO, this plan's a PPO, and that they may be eligible for some significant tax benefits if they go that route.
And with respect to the portion of the question about transparency and how effective is that in modifying mindsets and shifting behaviors, is, market dynamics dictate that when you do have more skin in the game, you do start making some of those trade-offs. However, this is still healthcare, which is highly personal. So what we've seen, and there was a great article published in Health Affairs, that when people are served up the right information and are put in a position to make those trade-offs, then a significant portion of them sort of do make choices towards more affordable treatments at the same quality, but not to the same intensity you would find in other sectors like consumer packaged goods or something like that. So it is effective, but just a different level of intensity.
All right, well, we have a lot of green cards here to which we were not able to get, for which I apologize, but I think that also reflects the level of engagement of our consumers of health policy information here. Thank you for spending a beautiful Friday afternoon inside a very cool hearing room, helping us grapple with one of the most multifaceted set of problems in health policy these days. Thanks to Anthem and the National Consumer League for helping us think through this topic and assemble a great panel. And speaking of said panel, help me thank this panel for some wonderful discussion. And we'll come back to this topic in September. Thanks very much.